The eyes do more than only allow us to see. They also have a voice. Certain regions of the eye can suggest underlying health issues. What do we mean by that? What are some of the other important diseases seen through the eyes? In today's video, we'll learn more about it. Hello, this is Scope Care. We are raising health awareness one step at a time. So make sure to subscribe to the channel and switch on notifications to ensure that you do not miss any of our great videos. Let's get started with the topic for today. The eyes are said to be the window to the soul. However, according to a group of researchers, they could also be the heart's window. You're probably picturing chest pain, difficulty breathing, and lightheadedness when you think of indicators of heart disease. However, new research from UC San Diego Health suggests that monitoring your eyes could provide an early indicator of cardiac problems. The eyes are especially fascinating to research since they are the only spot in the body where our tiny blood vessels can be seen clearly. Reduced blood flow, as well as other heart disease-related conditions including high blood pressure, can cause noticeable eye damage, alerting doctors to underlying or future problems. But for the time being, let us discuss how eye exams might detect heart diseases. The eye is the only area in the body where a doctor can see blood arteries, nerves, and connective tissue in real time without undergoing intrusive treatment. As a result, eye specialists are frequently the first to notice health problems such as high blood pressure, high cholesterol, stroke, and other issues. While eye strokes leave a small number of marks in healthy persons, those with heart disease have a far higher amount. The findings were based on an examination of the medical records of 84 persons with heart disease and 76 healthy people who had all undergone a retinal OCT scan. Signs of heart disease in the eyes. Cardiovascular disease can manifest itself in a variety of ways, including chest pain or pressure, exhaustion and shortness of breath, as well as high blood pressure and irregular pulse. Your heart may not be pumping blood efficiently to the tissues and organs in your body if you have cardiovascular disease or a problem with a valve. A lack of oxygen to the organs, including the eyes, can cause a variety of indications and symptoms, which is why a full eye examination is so important for your health. Here are some visual abnormalities that may indicate heart disease. Changes in blood vessels in the eyes are the first. The blood vessels of the retina can be damaged by high blood pressure. A variety of alterations to the blood arteries can occur, including constriction and ballooning. There may also be swelling at the base of the optic nerve. Fortunately, vascular alterations are frequently detectable during an eye exam. Cholesterol deposits in or around the eyes are also a possibility. High cholesterol levels raise your chances of having a stroke or heart attack. If your cholesterol level is too high, it might cause cholesterol deposits around your eyes. The deposits often appear as yellowish lumps on the lower or upper eyelids, as well as the corner of the eyes. You could also have transient vision loss. A sudden and brief constriction of the blood arteries can cause transient or temporary vision loss, which could be an indication of cardiovascular illness. During a transient ischemic attack or TIA, for example, the blood supply to a portion of the brain is temporarily interrupted, which might impair the eyes. Because the symptoms are usually mild and do not result in permanent damage, a TIA is also known as a mini-stroke. Some people may be unaware that they are experiencing a TIA. That's why it's critical to notice warning signs like a transitory visual loss. Researchers looked at the symptoms of 2,398 persons who were presumed to have had a TIA in a study published in Clinical Ophthalmology. According to the findings, 34% of the people exhibited visual symptoms such as eyesight loss. All right, friends. Before we continue to discuss how heart health can affect the eyes, if you appreciate what you've seen so far, please give this video a thumbs up and leave a comment down below. Your heart health is linked to the health of all of your body's organs. High blood pressure can cause decreased blood flow to the eyes and damage to the blood vessels if you have cardiovascular problems. The following are some of the ways that your heart health might affect your eyes and vision. The first is a vision that has been distorted or lost as a result of a stroke. For a variety of reasons, a stroke can result in impaired or lost vision. Up to 2/3 of people who have a stroke experience vision change, according to the National Stroke Association. A stroke can harm the area of the brain that interprets visual information. As a result, visual perception issues such as diminished peripheral vision, double vision, and even blindness may develop. Retinal artery occlusion is another possible side effect. A retinal artery occlusion occurs when blood flow to the arteries in the retina is blocked. It is caused by an embolus, which is either a cholesterol buildup or a blood clot, and is also known as an eye stroke. Although the cause of a retinal artery occlusion is unknown, it is considered that having a condition like heart disease increases your risk. Floaters in your field of vision, as well as pain and pressure in your eye, are signs of retinal artery occlusion. It's also possible to lose your vision. If you or a loved one is experiencing troubling symptoms like floaters or pain in the eye, see your doctor to avoid a vision-threatening emergency. It may also raise the risk of developing other eye diseases. Cardiovascular disease patients may be more likely to develop certain forms of eye issues. According to a study conducted by the American Academy of Ophthalmology, patients with heart disease have a higher risk of suffering vision loss due to age-related macular degeneration. Let's discuss how to avoid heart disease now. Family history and age are risk factors for heart disease, according to the Centers for Disease Control and Prevention. But many risk factors may be controlled. A heart-healthy lifestyle is an excellent approach to lowering your cardiovascular disease risk. Furthermore, having a strong heart might lead to having healthier eyes. You can avoid heart disease by doing the following. Regular exercise is essential. Smoking and other vices should be avoided. Keeping a healthy weight is important. Trans fats should be kept to a minimum. Eating omega-3 and fiber-rich meals, developing good coping mechanisms to deal with stress, maintaining a good blood pressure level. Therapy gardens are also beneficial since they alleviate stress and provide a sense of well-being. This results in significant psychological, physiological, and behavioral benefits such as decreased anxiety, melancholy, and other negative moods, lower blood pressure and increased immunological function, and better adherence to treatment protocols. Aside from heart illness, several other important health conditions can be detected in the eyes, one of which is high blood pressure. When the force of blood on an arterial wall is too great, it causes high blood pressure, often known as hypertension. High blood pressure in the eye can result in a retinopathy or damage to the eye's primary blood supply. This can result in eye hemorrhage, blurred vision, edema, blood clots, nerve damage, or even a stroke in the retina, resulting in complete vision loss. Even without using a blood pressure cuff, eye specialists can examine the status of our eye's blood vessels to see if we have signs of high blood pressure or diabetes. In addition to that is diabetes. Diabetes is another condition that is frequently detected through an eye exam. People may not have seen any visible signs of diabetes because it has a delayed onset. High blood pressure levels in the eyes might cause difficulties with the tiny blood vessels. If this happens, a patient may develop diabetic retinopathy, which can result in blindness as well as heart and kidney problems. Arthritis is another. A routine eye exam can show not only heart abnormalities, but also systemic inflammatory illnesses that cause arthritis and inflammation in other parts of the body. Many of these illnesses that cause ocular arthritis can induce inflammation, which can lead to pain, redness, and vision loss. Dry eye, which is usually associated with these illnesses, can damage the cornea, the dome-shaped transparent surface of the eye, especially if it is severe and untreated. Eyes can also be used to detect Parkinson's disease. There is currently no definitive test that doctors can use to diagnose Parkinson's disease. Symptoms and a neurological and physical exam are used to make the diagnosis. Ocular tremors are common in persons with Parkinson's disease, according to studies, especially in the early stages before additional symptoms appear. It can be evaluated for ocular tremors using eye tracking technology. So the next time you're tempted to skip your long overdue eye exam, keep in mind that you might be missing more than meets the eye. Are these facts beneficial? Please share your thoughts in the comments section below. That concludes today's video. Please subscribe to the channel and switch on alerts to receive updates of new uploads. Scope Care here, and we'll see you in the next video.